I really think MRD is one of the most exciting areas in the hematologic malignancies, so probably in the whole field of oncology. Why? Because the MRD in mantle cell lymphoma is evolving very, very fast. Not only we could measure the minimal residual disease, but also we can achieve deep, profound molecular remission. And not only that, we are able to use the MRD methodology to track the clonal evolution. So if the patient appear relapsing, we can actually caught the relapse at the molecular stage. We can actually use therapies to strike the molecular, the relapse, to treat the relapse, attack relapse, whatever word you want to use, to get rid of the clonal evolution at a molecular stage. Everybody remember, please, it's not hard to imagine when the patient have a big tumor, it's very hard to eradicate the whole tumor. But when the patient have a small tumor, we can much easily to eradicate the tumor than the big bulky tumor. But imagine we could actually eradicate the evolution of the clone, emerging clone, before they can form a tumor mass. That is much easier. We don't need much therapy. We can track them with the MRD, whether they disappeared or they reappeared. We can keep doing that. Those will be in the next stage of a therapy era. In summary, the mantle cell lymphoma therapy has evolved from the past chemotherapy to chemo-free therapies in the immediate past and to the current therapy of a cell therapy era. But after cell therapy era, we're going to reach the next therapy era, which is the precision medicine era in mantle cell lymphoma. MRD is just one of the molecular type things and tools that we can use to strike the relapse at early. But we could also use multi-omics and biology mechanical studies to track the clonal evolution, especially the powerful single cell technologies, including single cell RNA, DNA, proteomics, to track the clone and to decipher not only the evolution of the tumor cells, but also the CAR T cells, but also very important, the tumor microenvironment. So when we reach that age, we can decipher, we can actually find out the clonal evolution of the malignant driver-resistant clone. We know exactly what pathway is upregulated in that driver relapse clone, and we can knock it out with the precision. That's the next era after the current cell therapy era. I'm very, very, very excited. Me and my colleagues are very together in collaboration with many respected colleagues in the field. We think that mantle cell lymphoma, we could cure a population of mantle cell lymphoma within our career time using all the therapies I described above. I'm particularly excited that what's happening in the laboratory and what's happening in the clinical trial are getting closer and closer. In the future, in the near future, laboratories and the clinics are not separable anymore because in order to cure diseases such as mantle cell lymphoma, we need the two to be together, and we need the precision medicine to happen.